If Congress doesn't act soon, millions of Americans will wake up to find that their health insurance premiums have doubled, or that they can no longer afford coverage at all. The reason? The enhanced subsidies under the Affordable Care Act, which made insurance affordable for millions of families, are about to expire. These subsidies were first expanded during the pandemic, then extended through the Inflation Reduction Act, and they've been a lifeline for middle-class Americans who don't qualify for Medicaid, but still can't shoulder the full cost of private insurance. If we let them expire, the average person could see their premiums increase by more than $1,000 a year, and some families will face bills rising by hundreds of dollars every single month. This isn't just about numbers. It's about whether we believe healthcare should be accessible or reserved for the lucky few. Let's start with what these subsidies actually are. They're not a handout. They're a mechanism that makes insurance premiums proportional to income. Before the enhanced subsidies, many middle-income families fell into what's known as the subsidy cliff. They earned just a bit too much to qualify for assistance, but not enough to afford skyrocketing premiums. The enhanced subsidies fixed that by removing the cliff and capping premium costs at about 8.5% of a household income. That change opened the door for millions of working families, freelancers, and small business owners to finally afford coverage. Without it, we return to a system where affordability depends on luck and geography rather than fairness and need. Reinstating these subsidies isn't just about compassion, it's about stability. Health coverage keeps families healthy and the economy functioning. When people lose insurance, they delay care, skip medications, and end up in emergency rooms once conditions spiral out of control. That drives up costs for everyone: patients, hospitals, and taxpayers. The Congressional Budget Office projects that letting these subsidies expire would push more than 3 million people into being uninsured and increase premiums for everyone else because the risk pool shrinks when healthier people drop out. This isn't something we can fix later. Open enrollment begins in just a few weeks. If Congress delays, people will lock into plans that suddenly become unaffordable, and by the time the panic sets in, it'll be too late to undo the damage. Now let's address some of the common talking points used to justify letting these subsidies expire. The first one is that the subsidies are driving up inflation. That's false. Healthcare costs are rising because of hospital consolidation, drug pricing, and administrative waste, not because families are getting help paying their premiums. In fact, keeping people insured helps control healthcare inflation because preventive care is cheaper than emergency care. When people can afford regular checkups, they don't end up in the ICU with conditions that could have been treated months earlier. Another claim is that these subsidies benefit people who don't really need them. The data shows otherwise. The average marketplace enrollee earns around $50,000 a year, hardly the wealthy elite. These are teachers, contractors, and self-employed workers who don't have employer coverage. Without subsidies, many of these people will face premiums that cost more than their rent. This isn't about luxury. It's about survival. Then there's the argument that we should just let the private market handle it. We tried that before the ACA. Insurance companies denied coverage for pre-existing conditions, charged women more than men, and canceled policies the moment people got sick. The ACA set up guardrails to stop that abuse, and the subsidies are what make these protections sustainable. Without affordable access, those guardrails collapse. You can't have a functional marketplace if people can't afford to participate. And finally, we need to talk about one of the most persistent myths, that illegal immigrants are getting free health care through the ACA. This claim is simply false. Undocumented immigrants are not eligible for ACA subsidies, period. They can't buy marketplace plans, they don't receive federal premium tax credits, and they aren't part of this debate. What the law allows because of long-standing federal policy is emergency medical care regardless of immigration status. That means if someone shows up to an ER having a heart attack, they get treated. That's not a loophole, it's humanity. It's also public health common sense. Refusing care in emergencies would spread disease and increase mortality, which ultimately costs all of us more. But the idea that undocumented immigrants are draining ACA funds or getting free Obamacare plans is a talking point designed to distract from the real issue, that millions of citizens and legal residents are about to lose affordable coverage if Congress fails to act. And of course, the least favorite argument, we can't afford this, it'll add to the deficit, but the math doesn't back that up. The cost of extending the subsidies is far smaller than the cost of uninsured showing up to emergency rooms unable to pay. Uncompensated care gets absorbed by hospitals and gets passed down to taxpayers and insured families in the form of higher premiums. In other words, not funding subsidies is the more expensive choice in the long run. Keeping people covered isn't just morally right, it's fiscally responsible. We're at a crossroads. The Affordable Care Act has been the most successful healthcare reform in modern American history, and the enhanced subsidies finally made it work as intended. Millions of families, many in rural conservative states, have had stable, affordable coverage for the first time in their lives. Letting that progress evaporate would be a deliberate choice to make Americans sicker and poorer. So don't wait for someone else to fix it. Call your senators, call your representatives, and tell them to extend the ACA subsidies before open enrollment begins. Because this isn't about politics, it's about people. It's about whether we want a country where healthcare is treated as a privilege, or one where every family, regardless of income or zip code, has a fair shot at staying healthy.